The AM to PM Wellbeing Service acknowledges the announcement by Health Secretary Wes Streeting regarding an independent review into the rising demand for neurodevelopmental and mental health services. We welcome any rigorous, evidence-based examination that aims to improve the system for those seeking support. Our frontline experience strongly corroborates the data cited. We have witnessed a significant and sustained increase in referrals for anxiety, depression, ADHD, and autism assessments, particularly among working-age adults. To attribute this surge solely to potential overdiagnosis, as initially suggested by the Secretary of State, risks oversimplifying a complex societal crisis and stigmatizing those seeking help. From our perspective, the driving forces behind this demand are multifaceted. Number 1, reduced stigma and greater awareness. A positive cultural shift has enabled more people to recognize their struggles and seek validation. What may appear as a sharp rise in diagnoses is, in part, a long overdue correction of historical underidentification. Number 2, the pandemic's lasting scar. The COVID-19 pandemic acted as a profound social and psychological disruptor, exacerbating latent conditions, creating new trauma, and dismantling coping mechanisms for millions. The correlation with rising disability benefit claims is a stark indicator of this impact on functional capacity. And number 3, a crisis of access, not just prevalence. The staggering 13-fold increase in autism assessment waits since 2019 highlights a system buckling under demand, not necessarily an epidemic of new cases. Long waits worsen outcomes, increase distress, and inevitably lead to a backlog of pent-up need finally reaching services. We agree with Professor Fonagy that the review must be built on solid ground. It is imperative that the investigation moves beyond merely quantifying demand and scrutinizes the adequacy of the system's response. The promised £688 million for mental health staff is a necessary step, but workforce expansion takes time. We need immediate, intermediate solutions to support those in the ever-lengthening queue. Our key recommendations for the review are: Number 1, focus on functional outcomes. The goal should not be merely to diagnose or not diagnose, but to understand what support, whether clinical, occupational, or social, enables an individual to live a fulfilling life. A strictly clinical lens must be broad enough to include social determinants of health. Number 2, address the assessment bottleneck. Explore innovative triage and assessment pathways, leveraging trained specialists across multidisciplinary teams to improve efficiency without sacrificing quality. Number 3, invest in post-diagnostic support. A diagnosis is a beginning, not an end. The current dearth of post-diagnostic support for ADHD and autism in adults renders the assessment process almost futile for many. Funding must follow the patient through their entire journey. And number 4, listen to lived experience. As Professor Fonagy notes, listening to those affected is paramount. The review must center the voices of service users who can best articulate the barriers and gaps in the current system. At the AM to PM Wellbeing Service, we see daily the very real, often debilitating, struggles faced by our clients. While we support a review that aims to ensure accurate diagnosis and effective use of resources, we caution against any narrative that inadvertently undermines the legitimacy of people's experiences.
Real change starts with people, it starts with us. At the AM to PM Wellbeing Service, we're building a platform for grassroots action. When you like, share, and subscribe, you amplify our mission and help us empower communities to build a better future. This is how change happens.